And we've got Hilary Hall joining us, who works at Health Sciences University, but she's going to give us a little bit of an insight with regards to the 10-year plan that's come out and how ECP can really support that moving forward. So Hilary, I'm just double checking because I did see you on the call.
Yep, no, I'm here.
Yeah,
Thank
you're
you.
there.
Thank you, Amanda.
Brilliant.
Yes, thank you very much. So yeah, I'm Hilary Hall. I'm a strategic partnership advisor at Health Sciences University. And prior to working in the university, I've been an AHP lead in a provider organisation, an ICS, and also at a regional level. And what I want to do in my session, I am going to briefly recap upon what Alison and Claire have already said regarding where ECP sits within the workforce and the scope of practice, before moving on to consider the implications of enhanced clinical practice within the 10-year health plan. And so when I was first asked, oh no, go back, Claire, please. Amanda, sorry. So when I was first asked to speak from a systems perspective, I was going to do so from this perspective of integrated care systems. However, whilst I was on holiday, the Fit for Future 10-year health plan for England was published. So I have decided to relate my session towards this, recognizing that I'm a little bit I'm not completely familiar with this plan yet, but I'm going to do my best to share with you what I think is relevant to us in today's session. Systems are changing, and we need to start to get our heads around what system working will look like in the future and how the workforce needs to adapt. And we can use ECP apprenticeships as a tool for the required workforce transformation. Next slide. So before I go on to talk about this changing landscape that our workforce will be working within, just want to briefly remind you of these overviews so that we can understand where enhanced practice sits within the workforce and therefore the size of the potential opportunity. And again, we've seen these infographics already in today's session. On registration, AHPs are already autonomous practitioners. And you can see from the diagram on the left that enhanced practice sits between preceptorship and advanced practice. And we know how much work has already been done nationally and locally to ensure competencies and capabilities for these ends of the career journey. And through these apprenticeships that we're talking about today, the same will be done for those working at enhanced level of practice. And as we heard earlier, the diagram on the right depicts the size of the healthcare workforce within the size of the circle. This reflects the numbers practicing at this level. So we can see that the larger proportion of the clinical workforce are at an enhanced level. And this gives us a great opportunity to consider how we systematically start considering how we target this workforce at scale in a proactive and planned approach to ensure that our HPs will be proactive and influential in the forthcoming transformations. And I want you to bear this in mind as we go through the next few slides. Next slide, please, Amanda. So England's 10-year health plan, Fit for Future, was published at the beginning of the month. And this will become, I believe, an essential document for our HP leaders, helping to guide them with their workforce transformations to deploy HPs most effectively within the system. And the enhanced clinical apprenticeship should be used as a tool to help with this. The slide is just summarising some of the key points that the King's Fund have sort of highlighted and worth looking at the King's Fund report before you sort of go on to the full report. Next slide, please, Amanda. So in the King's Fund, sorry, can we go back to that slide? I did miss a point there I wanted to say. The first bullet point here talks about a commitment for all staff to have a personalised career development plan. And I think this is an opportunity for us to bring in enhanced practice within this and think about the training opportunities for your staff and your services. Recognising what Claire was saying, the training needs and training offers will be different for different people at different stages within their career development, but the ECP apprenticeship is something to be considered. And I also wanted to draw your attention to the last bullet point, which I think is really important for us to think about. This talks about shifting staff skill mix. This is something that we have historically have not done well with AHP careers. Now, more recently, this has improved with advanced practice and consultant level practice, but I think that on the whole, other than that, AHP skill mixing has been done on an ad hoc and an informal basis with little consistency and rigor. And some of you might disagree with me with that, but my experience. And I do think that other professions are much better than us, and as such are more able to make the most of opportunities that new roles and workforce transformations give us. So this is our opportunity to focus on upskilling those working at the enhanced level. And as Claire's earlier slide stated, provides the missing piece of accreditation in mid-careers. Next slide, please. So before we start thinking about the plan's impact on the workforce, I would first like to describe the new model of healthcare and its systems that we are rapidly transforming towards. So we know that one of the 3 shifts is to move care into the community, and the plan is to develop local neighbourhood health services. This means developing neighbourhood health centres which serve a population of around 50,000 people, and these are likely to be aligned with existing PCN footprints. These will then be supported by multi-providers supporting populations of over 250,000 people, and these will be providing more specialist services such as end of life. Now, the neighbourhood health centres will bring together professionals from all sectors to help to create an offer that meets the population need holistically. And it's important to understand that this means bringing traditionally hospital-based services into the community. So both the acute and the community workforce will need to adapt to this change, which will require workforce transformation and the upskilling of staff. Hospitals in the future will employ a smaller proportion of NHS staff and will focus on providing the best, most cutting edge and most productive care for those who most need it. And HPs within a hospital setting will need to consider how their roles need to change and adapt in order to be much more proactive in improving the productivity and improving care and reducing risk, as we've already heard from what Alison was saying in her presentation at the beginning. Next slide, please. So in terms of the workforce, we now know that there will be fewer staff in the NHS than was projected in 2023, and that a workforce plan will be published later this year, as Claire already mentioned earlier. But we already know about this new plan. Instead of asking, how many staff do we need to maintain our current care model over the next 10 years? This plan is going to ask, given our reform plan, what workforce do we need? What should they do? Where should they be deployed? And what skills should they have? I think this is going to reflect a shift in how HP leads will undertake workforce planning and modelling, and it will be essential that they have a strategic input into the workforce planning at a system level where possible. Ahead of this workforce plan, though, we already know that the 10-year vision is for a workforce where every individual is supported to reach their full potential, developing new skills to operate at the top of their professional capability. And the plan also highlights great potential for new advanced practice and consultant practice roles, particularly in the neighbourhood setting, and I'll touch upon that in a second. Next slide, please. A lot of words on this slide, so please we'll circulate them to you, and you won't be able to read them all here, but I just wanted to touch on some of the key points in this slide. So it provides some further detail taken from the 10-year plan, where we can see that staff will be supported by a skills escalator, which will give staff a trajectory for clear career progression with increasing autonomy. There's also a strong focus for advanced practice in the plan. And whilst the plan references nursing staff, we could argue that these points are relevant to us as HPs as well. Again, we need to understand and note the shift towards more accreditation and regulation of advanced practice, which in turn will mean that we need to strengthen the progression of our HPs towards this through accredited training, such as the Enhanced Clinical Practice Apprenticeship. The plan also highlights the consultant level opportunities within the neighbourhood health services, including in advanced clinical care and systems leadership, driving improvements in care quality and advancing professional practice. We need to ensure that our AHP workforce are prepared for these opportunities by having an increased focus on their career development during the mid-career phase, as we've heard from Claire and Alison previously. And we also welcome the plan's acknowledgement of advanced practice and consultant practice roles and need to ensure that the HP leads are involved in the workforce transformation discussions, as well as ensuring that the foundations for developing professional practice through the ECPs are in place for AHPs locally. Next slide. So this has just been a very, very whistle-stop tour of some of the key things that I've picked out from the plan, which I think relate to sort of ECP and the discussions we're having today. So in summary, what do we think that the 10-year plan means for the HP workforce transformation and ECP in particular? Firstly, as I previously suggested, this is an opportunity for HP leaders to be on the front foot, preparing the workforce systematically by engaging in the organisation's workforce planning to consider how best enhanced and advanced level training fits into their services. HP leaders that have been involved in workforce modelling and planning based upon the 2023 workforce plan will now need to rethink their previous work. We do know that HPs have huge potential to be influential in the 10-year plan's ambitions, and this could restore faith in their professional practice for many HPs who've become disillusioned by losing their professional skills and their identity. We are autonomous practitioners, but have had little focus on supporting the increasing autonomy ahead of advanced practice, particularly in the mid-career phase, so we welcome the plan's ambitions for increased autonomy. And finally, I wanted to recap on the points in bold from Claire's earlier presentation. These are so important in light of the 10-year published plan ahead of the forthcoming workforce plan. And that's all I was going to say, Amanda. I was going to leave it at that for now.
Thank you, Hilary, so much for sharing that with us. Are there any particular questions with what Hilary said, with in mind that obviously the 10-year plan is still very fresh for all of us, and I'm not sure all of us have got to the end of the document yet, and we're looking at how that relates to all of us and our workforce. Okay. Thank you, Hilary, so much for sharing that vision with us and that interpretation as to where ECP could be really, really beneficial and optimize what's happening for our AHPs. That's really important.